Hey guys, I just picked up my insulin and I thought I'd share for some awareness. $2,671.99. 8 bottles of this stuff. It's out of control and it's insane.
One of her TikTok videos reached 4.1 million people, but don't call this creator an influencer.
I hate that word.
Instead, Megan Cornelius likes to think of her videos as a resource for the millions of people in need of insulin, a life-sustaining drug often required for patients with diabetes. For many, the cost of survival is at an all-time high. According to our investigation, 60 times more expensive per milliliter than a 2008 vintage bottle of Dom Perignon.
Do you think people are dying because they cannot afford their insulin?
1,000%. Like, I can think of a couple people on the top of my head that have died because of it.
That they just can't afford?
They just can't afford it at all.
They're priced out of affording insulin.
Yeah. So welcome to another round of prescription costs in America for people living with diabetes.
Even with health insurance, Megan Cornelius estimates she pays up to $10,000 a year to manage her type 1 diabetes. Without her coverage, it could be a lot more, as much as $50,000. A congressional report found over the past 2 decades, the 3 companies that control most of the insulin market dramatically raised the list prices of their rapid and long-acting insulins. This graph in the report illustrates the rapid rise from $20 a vial in 1996 up to $274, a 1,200% increase. We looked up the retail prices of insulin online and spoke with pharmacists about the prices they see behind the counter. Right now, it's nearly $300 a vial, and most diabetes patients relying on insulin to live need more than one each month.
Who's at fault here?
Big Pharma, 1,000%. They're the ones that are price gouging. It takes less than $6 to make 1 bottle of insulin. I understand there's labor costs and whatever, but labor costs do not make up the gap of $350 and $6.
Here's how it works. Manufacturers make insulin. They sell it to pharmacies that fill the prescription for patients. But in the middle are the insurance companies who set what patients pay through things like copays and deductibles. But the complicated system doesn't stop there, and there are often pharmacy benefit managers, or PBMs, companies that insurance companies hire to manage prescription drugs, negotiating the prices and creating lists of which brands will be covered. Now think of all of this like a pie. Each part of the system gets a piece of the drug's overall cost. The manufacturers get the most, but USC research shows the portion insurance and PBMs get has been increasing. That's who the pharmaceutical industry blames.
Our companies are committed to delivering the best treatments, the best innovation to the most patients at the lowest cost.
We did an online survey that reached insulin users across the country. Those who said they had insurance through work reported paying an average of $170 out of pocket each month, but some reported paying up to $1,600. A trade and lobbying group for insurers places the blame back on drug companies, writing, "Insulin prices are too high because Big Pharma alone sets and controls the price."
The manufacturers help set the price, right?
The manufacturers do set the price, that's absolutely true, but manufacturers also deeply discount their products, and they do that because they want the products to be more affordable for patients. And again, unfortunately, the significant discounts that manufacturers offer and provide on insulin products are too often being held by insurers and by their intermediaries, and they're not being passed along to patients at the pharmacy counter, and we think that's wrong and needs to change.
One of the largest PBMs in the country, Express Scripts, says they aren't the problem. It's the manufacturer.
Rebates and pharma prices are constant negotiations, but there's only one group that controls the pricing, and that's them.
But because PBMs help decide what brands insurance plans will cover, a congressional report showed that power may scare the manufacturers into keeping prices higher. One company even saying it worried about retaliation, being cut off the approved drugs list and pushed out of the market. Here's why. Remember that pie? If the price goes down, the whole pie shrinks. Everyone gets less. But Express Scripts says removing the PBM's piece of the pie doesn't remove the pricing problem. The argument, they act as a buyer's club, behind the scenes saving patients money at the counter when they use insurance.
If you took us out, eliminated us altogether, you would have a 5% discount. But do you think that the pharmaceutical companies would actually lower their prices out of benevolence? Or would prices go up even faster? The reality is, I think they'd go up even faster. So the point I'm trying to make is that even if you take us out of the equation, you're not going to get to the low prices you're looking for.
So where's the truth? Congress believes the blame lies with both, calling out insurers and PBMs for incentivizing price hikes, but questioning drug companies' practice of raising prices in lockstep and manipulating the patent system to maintain a monopoly. One idea in Washington is to set a copay cap, blocking insurance and PBMs from charging over a certain amount. Both sides have also been challenged in court. Last year, the Mississippi Attorney General filed suit against the 3 major insulin manufacturers and 3 largest pharmacy benefit managers.
There's a scheme going on here. There's a pricing scheme going on, and we've got to make it affordable. And in order to do that, we've got to hold them accountable.
In the complaint, Mississippi calls the reason behind the increase in insulin prices a fraudulent conspiracy between billion-dollar PBMs and the manufacturers.
Well, they all should be working to the good, and they should all be held accountable, because the real people they're trying to serve are those that have diabetes. And they're getting financially wealthy.
We found consumers across the country have filed complaints with their state attorneys general about not only rising insulin prices, but insurance not covering the drug. As a leader in a state with a high rate of diabetes, but also as the mother of a type 1 patient, Lynn Finch says she thinks companies are putting profits over people.
They're gaining every day monetarily, and yet the individuals who are suffering are getting worse and worse and worse. They can't afford it, they're not taking it, and so it's a disservice.
To Megan Cornelius, being a resource means finding ways to help cash-strapped patients.
So just a little PSA for my diabetic homies, or really anyone in the U.S. that has a chronic condition. I went down to Rosarito, Mexico this weekend, and I decided to try to buy some insulin.
Her visit south of the border illustrates the ridiculousness of how insulin has become a pump for profit.
It's absolutely price gouging. I'm 30 minutes from the border to Mexico. I went to a wedding and stopped by a pharmacy afterwards. I paid $60 for a pen and a bottle of insulin. It took me 5 minutes and I didn't need a prescription. So tell me why a 30-minute drive I can buy 2 bottles of insulin for $60, and here that would cost me $700. It's the exact same thing.
In its 3-year investigation into the rising costs of prescription drugs, Congress found internal documents that revealed companies raised prices to meet ever-increasing revenue targets, which in some cases were tied to higher pay for executives. While Pharma says those amounts are comparing apples to oranges, to Megan Cornelius, it's still a clear indication this is all about greed.
They're absolutely exploiting Americans that need insulin. We can't live without it, so we have to figure out how to get it.
So you feel like they raise the price because you have no alternative?
Correct.
We reached out directly to the 3 major insulin makers. Eli Lilly and Sanofi responded, saying they've taken steps to help reduce the financial burden of their products on patients. Novo Nordisk did not get back to us. We also didn't get a response from the other 2 major PBMs, but that industry's trade group told us its members think more competitors and even playing field in the market will help bring prices down.